I'm joined now by Dr. Gyongyi Szabo, AASLD President-elect. Thank you so much for being here. I know that you are moderating this Global Health Forum, and we think about the global picture of liver disease. There are really a lot of disparities. Can you discuss those, where and what the biggest problems are?
Absolutely. Thank you, Dina. It's a pleasure to be here. We are very excited about the Global Forum that's going to take place on Monday at the meeting at the 2015 AASLD conference. Global Forum typically has a theme, and this year it's health disparities, which is somewhat of a new area that the AASLD thinks that we really need to explore. The health disparities are at multiple levels. We are going to approach this from the global standpoint in this particular forum by bringing in leaders from the world on hepatology from essentially the major continents, from Asia, Africa, Latin America, Europe, and the United States. Each speaker will discuss health disparities and in their own geographical region, but certainly there are common elements in terms of race and ethnic background, genetic backgrounds that may have an impact on disparities and differences in approaches to liver disease and outcomes. The additional disparities naturally include socioeconomic status, access to care, affordability. So we believe that all of these factors are going to be discussed, and we will learn a lot from each other in the kind of global way of improving the approach to liver diseases.
There is so much advancement, I think, in the study of liver disease and in the treatment of patients with liver disease. How will it impact them and really the world as a whole, patients all over, if we don't work together and try to get rid of some of these disparities?
Well, I think not working together would be a very bad outcome for society and for patients and for physicians too, because overall we want to treat everyone and have access and cure for everyone. So I think what we can learn from each other is that there's certain focus of disparities that might be explored in a particular region in the world could actually bring very valuable lessons to those of us who are practicing in a different region. So, for example, we may discover that some of the disease elements that people find or colleagues find, for example, in Africa on NASH or some of these diseases that are very prevalent in the Western world, could be somewhat different because maybe the genetic background of the patient population is different, although we are looking at people who have different skin color or even the same skin color, and yet there are multiple differences. So I think there are multiple elements here. The socioeconomic impact and status and access to care is something that I think has so much relevance locally, geographically, even within the United States, and naturally throughout the entire world. The insurance systems as being different between even various states in the United States, and then comparing those to the various countries in Europe and to whatever systems they have in Africa and Asia are going to be really interesting lessons to learn.
How do you communicate that message of bringing people together and really formulate a plan so that there is some work together?
Well, I think we have to take a stepwise approach, and I think AASLD is going to be very satisfied if we kind of have this as an initial step in the process that hopefully can be followed up in subsequent meetings, and hopefully we can follow it up with our sister societies in the future to have a global impact.
And that cooperation is key. Thank you so much, Dr. Szabo.
Thank you, Dana.